Hi, everybody. Welcome to our seminar. Really pleased to introduce Cristiani Machado. Still not sure if I'm pronouncing that correctly. Cristiani is from Brazil, from the School of Public Health, but she also has a role as Vice President for Communications and Dissemination.
Education,
Information
and communication.
At Fiocruz. And Fiocruz is a sort of important partner of Glasgow University. And also Cristiani is part of our unit on the social and environmental determinants of health inequalities. So we've had a long-term collaboration with partners in Brazil, and I'm glad to say it's continuing and expanding. But Cristiani, please.
Thank you very much. I'd like, first of all, it's a great pleasure and honor to be here at the University of Glasgow. I would like to thank Professor Alistair Leland for the invitation to the seminar, and also Jose Luis for his support, and John for the organization. And as Professor Alistair has said, we have a collaboration with the University of Glasgow that's very important to us. Oswaldo Cruz Foundation is a Brazilian research institution. It's a federal institution. It's linked to the Ministry of Health, and it's one of the oldest public health institutions in Latin America. It has just completed 122 years. That's quite old to Latin American partners. And I'm a researcher. I'm the Vice President of Education, Information, and Communication. And I'm also a researcher and professor at the National School of Public Health, which is completing 70 years this year. So it's also the oldest and most traditional public health school in Brazil, and one of the oldest in Latin America as well. And so the work I will present today is a part of my research. I'm a researcher on health policies and health planning and on health systems. I've been doing research, especially on health systems in Latin America in the recent years in a comparative perspective. I work more with health policy analysis and health systems analysis, like in a historical comparative approach and historical institutionalist approach mainly. So it's a more qualitative kind of study, although of course we use data in our studies, and I'm learning a lot by being a part of this unit in cooperation with the University of Glasgow as well. So the work I'll present today is a part of a study. I will focus on the response to COVID-19 in Argentina, Brazil, and Mexico, discussing the challenges for health coordination in Latin American federations. But this work that we will present today, it's a part of a broader research, a more comprehensive research that we have developed. Wow. It's not going to. Oh, loud. It's a part of a more comprehensive project that I have coordinated with two colleagues during the pandemic. We have to change our research proposals during the pandemic. And so we developed this project on national health policies and COVID-19 response, a comparative study of 9 countries. And this is the research team. It was coordinated by me, 2 colleagues. And we studied 9 countries in 3 different regions: in the Americas, Argentina, Brazil, Mexico, and Canada, China and South Korea, and Germany, Spain, and the United Kingdom. But we are focusing today on the 3 Latin American federations. Okay? So this is a very summarized version of our analytical framework. In each case, in each of the 9 cases, we studied the national context and health systems characteristics. These health systems are very different, have different histories, and we analyze the similarities and differences between them. The COVID-19 epidemiological dynamics, that means the evolution of the epidemic in each country. The national governance and intergovernmental coordination mechanisms, I put here federative coordination, referring to the 3 federations that we are focusing now today. The intersectoral contention and mitigation measures, that means the measures that involve different government areas to close borders, to do economic, to close commerce, and to the social distance measures and the broader measures to contain the pandemic, and also the social and economic policies to mitigate the effects of the crisis, like income transfers, like support to employees and to employers, and so on and so forth, to protect jobs during the pandemic. And but our main focus was the health system's response, of course, because of our profile. So we analyzed a little bit of private healthcare, health surveillance strategies, and access to testing and vaccines in the different countries. And finally, the factors that influence the response, the positive and negative effects in each case, and we tried to explain and to compare these countries. It's important to highlight that COVID-19 was very connected to inequalities, especially in Latin America. There were increases that are well reported in unemployment, in poverty, and in hunger. It's important to say that the region was already in a crisis, in an economic crisis before that, and some countries in political crisis as well, before the pandemic, and things got worse during the pandemic. And we also could observe some increases in inequalities, in income, race, gender inequalities. There are some works about that. And high mortality rates in Latin America, especially among vulnerable groups, the elderly, the poor, the Black, the indigenous groups. And also the mortality was very high among health workers. That was really terrible. The data is terrible. And we had also high maternal mortality. Some countries, some Latin American countries already had high mortality, maternal mortality rates, and it was dropping. The rates were dropping, but during the pandemic, they stagnated or they got worse. We reported high mortality, maternal mortality rates. And inequalities were also observed in health provision and access, including in vaccine coverage. And these inequalities, they manifest themselves in what regards COVID-19 results, but also in what regards the possibilities of people to adapt to the pandemic context, because informal employment in Mexico, in Brazil, for example, is very high. It's more than 50% of workers are in informality with precarious jobs. And so this affects their possibility of social distance and so on and so forth, of course. And in what regards Brazil, Mexico, and Argentina, these 3 countries together represent 4.9% of the world's population, but they represented 7.2% of the total cases in the world and almost 17% of deaths in the world. And Brazil accounted for a large part of this. Brazil is the 2nd country in the world in total number of deaths to COVID-19, only after the United States, and Mexico the 5th, for example. So these 3 countries together reported more than 55 million cases and more than 1 million deaths by COVID-19. Here we can see a comparison of the incidence, cumulative incidence rates and mortality rates by COVID-19 in the vertical axis. And we can see here the mortality levels were high. The United States levels as well. We put the United Kingdom here. The others are federations, federal countries. Okay? But they put also with mortality rates. But testing was quite low in some of those countries that have low incidence. Okay? Mexico, for example, had very low testing levels for COVID-19. So we are missing here cases and also deaths by COVID-19. And Brazil had low testing too in the first year, but after that, the second and the third got a little bit better. That's true. And in what regards the different evolution, the dynamics of the pandemic, the waves are rather similar between the two countries with some differences. One aspect to be highlighted here is that Argentina is the green one. This is the deaths per million. Argentina had this wave, this first wave, later than Brazil and Mexico, because the government adopted very strict measures of social distance and regulations at the beginning of the pandemic. Even it's a very decentralized federation, the national government adopted that. So they could delay a little bit of this wave of incidents. Here it's small because of the scale. This is the Omicron peak. So the incidence was very high, but with lower mortality levels here, lower mortality. And here Argentina got this first wave later, but they couldn't contain too much, and then the situation got worse after that. And Mexico had many different waves and a later process of vaccination. Here we can see the vaccine doses for 100 people, the first figure, and the second one is the deaths per million. And here, just to illustrate the vaccination effect, which was very important to control the pandemic from 2021 on. Okay? And so we could see Brazil and Argentina had high peaks of cases and mortality here, but then the levels dropped after the vaccination process got reasonable coverage levels. And in Mexico, the vaccination was slower, and the effect was a little bit slower as well. They were already in a new wave when they started the vaccination process. Here is another important information about excess deaths, the excess of the mortality excess in the two countries. This indicator measures the number of deaths compared to the expected deaths based on a previous historical series, okay? So we can see here that excess mortality was very high in Mexico. This line, this dark line is the COVID-19 deaths, and the red line, the excess mortality. So it seems that excess mortality was not only because of COVID-19, researchers say that two other studies, but also related to deaths that could have been avoidable if people could get proper care, because the health services were very overwhelmed, overloaded, and full, and some other problems couldn't be properly attended during this period. So in Mexico, the distance is greater, both because of sub-notification, under-notification, because testing was low, and probably because of other causes as well. Okay. In Brazil, the lines are more similar, and in Argentina too. And here the vaccination coverage, the immunization coverage, we can see that Argentina and Brazil could reach high levels of vaccination coverage with the basic scheme of 2 doses generally, okay? And Mexico a much lower vaccination coverage, and also the rhythm is lower. The vaccination pace was slower in the case of Mexico, as I have shown the other figure. Well, I won't go in details through that. I will only highlight some points, but this is a very summarized version of the analysis regarding some dimensions. In what regards governance and national coordination, Argentina even being a very decentralized federation, 2 countries are federative countries, and Argentina is very decentralized. The responsibility for healthcare is mainly of the provinces and not from the national government. But despite of that, the national government decided to coordinate the response to the pandemic very early and adopted several coordination mechanisms together with the provinces, together with the health authorities in the provinces to coordinate this process. And this was very important in the beginning to contain the rapid spread of the virus. And also indexatorial measures were more prominent in Argentina than in Brazil and in Mexico. Brazil has a tradition of coordinating, federative coordination in health. We have intergovernmental committees in the unified health systems that involve Ministry of Health, health secretaries in the states, and municipal health secretaries, representatives in the 3 government levels. Nevertheless, these mechanisms were not properly activated during the pandemic, in great part because of the federal government attitude, negationism, and the conflict posture towards state and municipal governments, and the problems of leadership and national coordination related to the president of the republic that used it to deny the pandemic, being against the strict control measures. So, unfortunately, despite the existence of these committees and this mechanism and this tradition in the unified health systems, they were not properly activated, and conflictive relations predominated. It was really hard to coordinate the process, okay? And Mexico doesn't have as well very strong coordinative mechanisms towards the state, but has a strong federal government. And there was some delay in this initial coordination in the implementation of measure, but later they released the national guidelines and initiatives, especially in health surveillance based on previous experiences. In what regards containment and mitigation measures, there were efforts in the 3 countries, but in Argentina, the measures for mitigating the economic and social impacts were more expressive and coordinated than the other 2 countries. In Brazil, they were very, very insufficient, and as well as in Mexico. They are more unequal countries as well, so the effects were severe. In what regards the health system response, despite the importance of the unified health system in Brazil, because we have universal and public health systems, this system was underfunded before the pandemic, was suffering from underfunding and low investments, and with several problems. And during the pandemic, there were some efforts in expanding hospital beds, for example. This occurred in the 3 countries, and but they were insufficient. And the territorial inequalities are very important in Brazil and in Mexico. Argentina has a very segmented health system, but the health services infrastructure is among the best in Latin America. They have more hospital beds, more doctors, although they are unequally distributed, but they have much more than the other 2 countries. So the system is segmented, it's heterogeneous, but they have this infrastructure available. And in the case of Brazil and Mexico, there were limits in expanding services to face the demand, the increasing demand for hospitalizations and so on and so forth. One problem that was common in the 3 was the low investments and low priority to primary health care in the response. That's what was a problem in the 3 cases. Primary health care should be more prioritized during the response to COVID-19. In Brazil, we have a very reasonable coverage, but it was not fully, prioritized during the pandemic. And here we are summarizing some factors that have influenced the response to COVID-19 in the 2 countries. We identified both structural, historical, institutional, political, conjunctural, and societal factors that have influenced the response in the two countries, and they combine themselves in different ways depending on the context. In what regards the structural dimension, the three countries are upper middle income countries, and they have some capacity, some state capacity in public policies. They have some tradition in public policies. But on the negative side, they are marked by economic and social, severe economic and social inequalities, especially Mexico and Brazil. And they suffered from the global asymmetries in resources and in science, technology, and innovation, because they had difficulties in accessing, for example, important supplies to face the pandemic. In their populous countries, especially Brazil. So there's a large, the necessities were huge to face the demand. And in what regards the historical constitutional aspect, in Brazil, the existence of a universal and public health system was very important to this response of the pandemic. And the public offer that have the public services and also the tradition in health surveillance. In the other countries, you don't have a universal system, but the efforts that were made by the public health services and by the professionals and by the managers was very important as well. The role of public universities was important in the three countries in developing research and support to face the pandemic. And in Brazil, the national production of vaccines. The other two, and they didn't have such strength in national production of vaccines. Brazil has a tradition in national production, public production of vaccines, and Argentina and Mexico tried together a joint initiative to produce vaccines, but it was not so successful and so important. They depended mainly on the importation of vaccines, okay? Buying vaccines, but they tried an initiative that worked partially. And so this, but otherwise, nonetheless, there were severe limitations in public health systems regarding to low investments, fragmentation, segmentation in the three countries, insufficient investments in primary health care, and also difficulties in integrating primary health care and health surveillance mechanisms, and low testing in the three, comparing to other places. Argentina was a little bit better in this indicator. And also limits in high dependency on imports of vaccines, of the basic ingredient, active pharmaceutical ingredient to produce vaccines in the Brazil, even in Brazilian cases. We had agreement with the AstraZeneca company to produce vaccines in Brazil, but we depended on the imports of the IFA, the basic active pharmaceutical ingredient at the beginning, and later we got the total technological transfer to produce the vaccine entirely in Brazil, okay? In what regards the political conjunctural, as I already mentioned, the federative coordination efforts that were important in Argentina, but they were not sustainable because they don't have this institutional framework so strong. Then it depended highly on political efforts and political agreements. And when this dissipated and when the conflicts began back, when the situation got worse, this was dissipated and these efforts were not sustainable. And in Brazil, we had initiatives of some subnational governments. For example, states from the northeast of Brazil, they came together to work together because the federal government had severe, this negationism approach, so it's very critical. And so we had some difficulties in federative and intersectoral coordination between governments in the three cases at some level, some denialist political decisions and limited dialogue with society, especially in Brazil, in the Brazilian case, and government resistance to the adoption of more restrictive measures that happened in Brazil and in Mexico, and in the state level too. In Argentina, the federal government was the most, committed to this restrictive measures, but it was criticized. The government was very criticized as well because of that. And in the societal dimension, it's important to highlight the commitment of public health organizations, scientific societies, specialists, and health professionals, and the community mobilization in some areas by non-governmental organizations, local associations. The society was mobilized even in poor areas to organize themselves. This was very important. And a high adherence to adult vaccination. I'm highlighting this because we had other problems. Low adherence to physical distancing measures as the use of masks. It was really hard in the 3 countries. And sometimes it's not possible to do physical distancing. If more than half of the population depends on precarious jobs, they are on the formal market, they can't do that. And fake news, the spread of fake news that was really severe. And in some groups, hesitation against vaccinating children. That's what was observed in the 2 countries. In Brazil, it's very impressive, because we have quite a tradition of the national immunization programs in Brazil. In children vaccination coverage is usually used to be very high. In the last years, we had some drop in the children immunization coverage in Brazil. There are diverse factors involved, but in what regards COVID-19, this was really terrible. People were afraid of vaccination, their children, and the government, the federal government itself, the former government, because we changed the government recently. But the former government did not incentivize vaccination at all, and neither amongst children. So, concluding, and the research allowed us to identify some lessons and challenges that are critical for facing health emergencies in the future. One of them is the importance of adopting and making stronger mechanisms of governance and national coordination in what regards the political institutional level, like committees, actions of continuous coordination, operational mechanism, logistics included, and informational also aspects. The flow of information, the information, health systems information, that we had lots of problems with this, with communication with society. It was really a critical aspect. The necessity to adopt prompt measures to prevent and control the spread of disease, prompt and coordinating between sectors. The necessity of the need to expand investments and strengthening public health systems, because the private health sector adopted a more individualistic approach and to take care of the people who paid or who are affiliated to the health insurance. And in Brazil, we had a lot of trouble with that because we couldn't integrate the systems. There was some discussion about integrating hospitals beds to guarantee access to all people, and the private sector said, no, our beds will be only to, and they have more intensive care units, for example, much more than the public health systems, and it wasn't possible. Sometimes there was ociousity in some private hospitals, some top-level private hospitals, and they wouldn't make the beds available to the public health systems and to general population. And of course, the disease was spreading, so this was severely complicated. And the need for more investments in scientific and technological development in the national production of strategic inputs, such as vaccines, drugs, some masks. There were shortage of supplies in the international market, and sometimes we didn't have the supplies. We didn't have the medicine which is needed to, how can I say, intubate, to do mechanical ventilation. We need to Isaacs to do the mechanical ventilation for ship missing. And so it was really critical. And the need for policies for economic regulation, labor protection, and social protection with general actions directed at vulnerable groups. Because the high level of informality and the scarcity of social protection of these people was very severe. And so inequalities got worse because of that during the pandemic, and there were many avoidable deaths that should be avoidable if they were socially protected. More dialogue and communication with society, with different social groups, to listen more to the groups, to the population, different profiles, and South-South cooperation, which is very important to strengthen the mechanisms for example, scientific development and production, regional production of supplies, relevant supplies, vaccines, and other relevant supplies. And it's important to highlight that this must be done beyond the crisis in a structural and continuous strategy. So we have published this book in the beginning of 2022, which has some results about this research, including the 9 countries. It's called Health Policies and Health Systems in Times of Pandemic. 9 countries, many lessons. It was organized by me with 2 colleagues. It's in Portuguese, importantly, but it can be accessed online and for free, because we published some books about the pandemic, 5 books online and for free during this period. So that's it. Thank you very much.
Thank you very much. Fascinating. I'll just see if there are questions coming in. If you're watching on Zoom, please do put questions into the chat. And questions here. I'll start. Oh, sorry, I was going to start if I can, Kibuchi, but you were talking about the response of the health system to the pandemic, but I wonder if you had any information about pandemic preparedness. I know the Health Observatory in Europe looked across countries and had been doing this as an exercise in advance of the pandemic and was grading countries on their pandemic preparedness when suddenly there was a pandemic, not the one they're expecting, but then the pandemic came. So I wonder if you knew anything about how these 3 countries were doing in terms of their preparations for pandemic before it all started.
That's an interesting question, because there were lots of publications that showed comparing different countries in the world, that the predictive models were not very efficient, not very reliable. There were studies. There was a famous study which was published before the pandemic, like 2019, 2018, comparing lots of countries, and they rated the countries regarding the preparedness to eventually an eventual pandemic, but their estimates were wrong. The model couldn't predict properly. And I have a student, a PhD candidate, which analyzed that concerning 18 Latin American countries and the international sanitary regulation by the World Health Organization, RSC, International Sanitary Regulations. They have this regular reports on health surveillance, epidemiological surveillance, and emergency preparedness with some quantitative indicators, but it's an auto report, the country's report, their capacities. And my students looked at the database of this report and rated the countries. And the predictive effect was none. But it can be a problem of the instrument.
Yeah.
The instrument is more an induction instrument than a good evaluation monitoring instrument. The international sanitary regulations framework of the WHO is more to, to stimulate countries to adopt such measures than in its auto report, and that has limitations. But the predictive capacity was null.
Yeah, Kabuchi.
So my question is regarding comparative swelling of the central valentine. I realize that always Argentina was in terms of the peak compared to Brazil and Mexico, except the that way. There's something which happened which made it the third way where Argentina.
Why the peak is greater?
Yeah. So for the initial two waves, Brazil and Mexico, their peaks were happening fast, and then it's followed by
Argentina.
yeah, you indicated it's because of the social distancing measures put down by it.
Yes, at the beginning, it makes the peak later.
But now on the third wave, it is where I think at the fast peak of Brazil and Mexico. There was change of
Yes, that's amazing because Argentina was considered a success in the beginning of the pandemic because they adopted these large strict measures, everything was okay, and then things got totally out of control. There were many conflicts regarding social distance and the use of masks. Then people went to the streets, and this there were resistance to that measures that were very strict at the beginning. And the population is mainly urban in Argentina. It's mainly urban. It's a very, very urbanized country. And so they are conurbated. And as in the population is like 45 million people in Argentina. In Mexico, it's much more. It's 150 something. In Brazil, more than 200,000 people. So the population is much bigger, and this is the denominator of and there is more rural population, and also in what regards the demographic structure, there are a higher proportion of elderly in Argentina than in Brazil, than in Mexico. Is a younger population. So there are some factors that must have in the testing. Testing was higher in Argentina, was higher in Argentina, testing levels. So I think they didn't miss many people. In Brazil and in Mexico, especially in Mexico, there is a lot of excess mortality of non-reported COVID-19 cases, excess mortality in general. And perhaps the low testing also explains why the mortality peak by COVID-19 wasn't that higher, okay? Because they were missing people. And we say that it's more difficult to miss cases, deaths than cases, but in some cases, when testing is very low, you are missing also the deaths by COVID-19, and that makes mortality rates lower, but some of this is because of low testing.
No, but I think it's about the timing of that Omicron peak as well. Why wasn't Argentina able to delay Omicron the way it had the first two waves?
Nobody was able, I think, to delay this Omicron peak. The first one, because the spread, it was much more contagious, much more infectious. It was amazing, and it was the summer. That summer was really impressive because people were traveling. Nobody could stand anymore to stay in isolation. So that summer, people were traveling, the airports were crazy in Latin America. And in Rio as well, I was very strict with my family at the beginning. I had to go to work, but I was very strict, and I have two young ladies at home. And in that summer, they were traveling and everyone got COVID-19, and I got COVID-19 because of Omicron, because my girls were, socially active again, and we couldn't help. And in Argentina, if you see some gatherings that were very important before that, and some more urban population, that the mobility is very intense, but it's difficult, it's hard to understand, because everything went down because they are being so successful, the government, and then woof, the place exploded.
Just kind of following on from Alistair's question, have the government and health ministries learned any lessons from this pandemic that they would apply to a future pandemic or other issues like when climate change affects Pekin as well?
So this is very important. Indeed, there are many lessons regarding the need for a more comprehensive approach involving environmental issues, involving sanitation measures in general and healthcare. And we had experienced some international emergencies before, so we had some organization. But this idea that the system must have investments in a continuous basis and not only in the case of emergencies is very important. Of course, we had learned a lot from the influenza pandemic, from emergency from 2009, 2010, and also from the Zika that was in Brazil was important. Brazil has a very reasonable system of health surveillance. The design is very interesting, federative, and so on and so forth. But the system was suffering with low investments before, and the political dimension, in the Brazilian case, the political dimension was very critical. The decision, the negationism, the decision not to do some things. In the Brazilian case, I would say that in Mexico, there are some structural elements that were important, like the inequalities, the segmented health system. The system was going through a reform at that point, but it was just beginning. So, but in Brazil, in the political dimension, of course, these lessons are important, even considering the problems of climate change and environmental issues. This country suffer a lot in the Brazilian case with problems, again, deforestation, and several problems that can bring other epidemics at any time. We are very aware of that, and so there is a concern. Now the government changed in the Brazilian case, then it's a more committed government to these issues and to this more comprehensive approach of environment, health, and one health approach in this kind of issue.
So I read there was a plot that showed vaccination uptake amongst adults. How so Mexico, yes.
In Mexico, no.
Oh, no, okay.
In Argentina and Brazil, yes.
Is that like, what started the cause behind that? Was like hesitancy higher in the UK and the US, or is it to do with like the community mobilization you spoke about?
You know, in these countries, we didn't have anti-vax movements. Yeah. There were no anti-vax movements before that. Now we have some anti-vax movement. And so we are very worried about that because we didn't have that. And so in Brazil, we have, for example, a very strong immunization program since the 70s. It's like a national proud. And since the unified health system has been implemented since 1988, this program becomes stronger. We use it to have very high immunization levels between adults and children, as of course, since 5-6 years ago, and then it began to decrease the immunization coverage. And we are already worried about that. And we think it's under investments, low investments in healthcare, that since the impeachment, since the political impeachment in 2016, things got worse in Brazil. And there were drops in investments in health and education, and science. And so this is quite complicated that precedes the COVID-19. And during the pandemic, the government, played an important role, and governments, and especially the national government, in spreading fake news, and the extreme right movement in Brazil spreading fake news regarding vaccines. Even despite that, we could reach reasonable vaccine coverage among the adults. But in what regards the children, the fake news had a terrible effect. And it's strange because people used to take their children to, we have a very comprehensive calendar in Brazil, public, for free, and so on and so forth. And people would take the children to take their vaccines. And we are afraid that the resistance to COVID-19 vaccine must affect other vaccines. So there is this huge national program now to recover the coverage levels, the high coverage levels in Brazil. I don't know why. I don't know if in the USA, the United States for sure, there is a more important anti-vax movement. And I don't know, the United Kingdom, you should know more than better than me, if it's important here. But in Europe in general, I have some colleagues from France that say that middle-class people and even people who work in, some of them don't want to get the vaccine, and that's it.
Am I correct that Zika virus prevalent in Brazil or present in Brazil?
It was, yeah, we had an epidemic of Zika virus some years ago, some 6 years ago, 7 years.
Could that have maybe, like amongst the general population led to sort of more of a realism about COVID-19? Did that, because there's a recent experience of deadly virus, that sort of like carry on and then we'll take COVID-19 more seriously, or is that? Whereas like you maybe,
I don't know. Yeah, I think people have a tendency to forget things quite easily. In the case of Zika, it was especially concerned. It was especially severe for women who were pregnant because of the malformations, and so regarding pregnancies, it was very critical. And of course, it was a severe epidemic, but it especially affected pregnant women and children who are born with malformation. But I don't know if for the epidemiological surveillance system, it was important because we learned a lot from that. And so we had some structures, but for the general population, there is a tendency now of people for avoiding this. We are worried about this legacy and these lessons, to what extent they will really make things change. This is our word.
Also, I'm going to hang on to say. I was hesitant in terms of vaccine. Recently, I noticed even this increasing. The reason why is if anyone has especially some how the FDA is going to vaccine. So now people are like attributing anything to vaccine testing. So rather than even people are receiving vaccine, they are kind of receiving it. This thing was introduced to the population. as the day. Especially in the villages.
I didn't know if I understood the,
So I'm saying in context of vaccine, the way it was used, rather than people being encouraged, let's say if another pandemic. So based on the experiences which people are having in terms of let's say local villages, they are now being more hesitant about the vaccine. Because any death
I
nowadays,
understand.
the rate of death nowadays is being attributed to vaccine.
Mhm.
So and so died.
Yeah, I understand. Yeah.
COVID vaccine.
Uh-huh.
So meaning that there is a lot of negative perception of vaccine.
You know, this negative perception occurs as well because people would take the vaccine and would have COVID in a way. So some people would say, wow, I took the vaccine, but my sisters took the vaccine and they're having COVID in a way. Why? And so the booster coverage was much lower, for example, than the basic coverage. I showed, I presented here the basic scheme coverage, but the booster was much lower, even amongst the elderly. And there is another issue about the vaccines that if you are not seeing the benefits, sometimes people are getting that happens in the case of polio. We had the eradication of polio, and so we're very glad about that in Brazil. And no one sees polio anymore. When I was a child, my mother had seen many children with polio, so she would take me, and in general, the mothers would be very. And now we don't have polio for many, many decades in Brazil. So people are more about polio. So the campaigns have to remember what polio is. And sometimes there is this denial. It's happening with HIV now, and you don't have the vaccine, but it's happening. People are forgetting. It's like nothing like the 80s. The prevention mechanisms are harder to convince people to prevent, to adopt the prevention measures properly, because we are not seeing anymore, because there are things to science, there is good drugs, you know, to treat HIV and so on and so forth. You can control the disease more time and people, and so we're not seeing anymore this. And so this is, it's quite complex, this dynamic. And the Pan American Health Organization has some comparative studies in the Americas, and they say that there are many reasons for this drop in vaccine coverage in the last years, including the changes in the work market. The women are working, and there are difficulties in bringing children to the services because it's the mother who takes the children, and the number of vaccines is much higher. The number of different vaccines that you have to take the children 10 times. In Brazil, you have to take the child 10 times to the health service to take the vaccines in the first year. And we don't have many services that open after hours and on Saturdays. You'd have to have long opening hours in the primary health care centers and units so that people could bring children after work and on Saturday morning. That's you to make.
I was going to ask a question, but I don't know if someone online wants that.
Okay, there's someone.
I don't know, but I mean, I can ask one.
Yeah, you go ahead, Ruth.
People who are remote gets forgotten.
Thanks very much, Cristiani. I thought that was a really nice case studies of different countries, and it seems to me that there were 3 different things that to be important. One is about consistent investment in the health service and the health system. One is about national leadership, and one is about local coordination. And you can see that local coordination is probably something that you can really plan for and have in place. National leadership, every 4 years or every 5 years, that could change. I just wonder if there's any, and I suppose investment may or may not get the investment that is needed. And I just wondered if there's any learning that can happen with the kind of local coordination that you had in Brazil. It was set up really nicely. You had the nice structures going from sort of federal health ministers right down to the kind of municipality health ministers. If there's any learning from that about how they can mitigate, I suppose, the effects of poor national leadership. you know, for the next pandemic that's coming, because the next pandemic could be someone, I don't know, even worse. In terms of
Yeah.
national leadership, but if you've got that local coordination.
Yeah, you know, in Brazil, we have 5,500 municipalities. It's too much, and most of them are small municipalities that don't have their own income levels, high income levels. They are dependent on federal transfers. So these federative mechanisms of transferring funds is very important, are very important in many areas, and especially in health. Federal transfers in health are an important part of federal health funding in Brazil. And so the municipalities are highly dependent on federal transfers. And state coordination is a little bit fragile in the Brazilian case because decentralization in the health system was mainly municipalist, we call, from the federal to the municipalities. It was since the 90s. And historically, the federal government plays a very important role in the health policy, historically. Even with decentralization, political and administrative decentralization in the federative context, the federal government kept an important role in norms and in funding mechanisms. And for example, there are important national programs as the family health program. It's a national program funded by federal funds, mainly through transfers. And so this mechanism is very important. And we have institutional mechanisms to coordinate this. Is this committees? We have the National Committee, Intergovernmental Committee, we call it tripartite because it's Minister of Health, State Health Secretaries, and representatives of municipalities. We have in each state one bipartite committee with the state secretary, health state secretary, and health municipality secretaries. And we have also regional ones. And we have also participatory councils, National Health Council, State Health Council, with the participation of civil society. And so those mechanisms, they exist and they usually operate well. Even if the government is right, center is right, it helps the systems go on, the existence of this institutional coordination mechanism. But this was a very atypical government. It's a far right government and with a very destructive politics towards public policies. So it was very complicated because they wouldn't use properly the existing mechanisms. You could have a conservative government, but still things go better. But this was a very radical government in this way. And one issue that we think it's important is to have these mechanisms in federative countries. Otherwise, public policies won't be well implemented, because we depend on the three government levels and they have to be concerted, coordinated. So this kind of institutional mechanism is important. In Argentina, they are weaker. So they tried politically to do this, but when political conflicts begin, political parties, and so this kind of more politically, I don't know if I answered it properly, okay? But
we've got one last question from Nai, who's asking about regional cooperation, saying Latin America has been known for this and gives rabies as an example, but asks whether there are examples of regional cooperation seen through the pandemic and also in terms of future planning for pandemics, whether there are signs of cooperation.
this is really very important. The Pan American Health Organization tried to do so, and there were some regional, sub-regional efforts as well, because there are some sub-regional structures, CELAC here, other regional below the PAHO, and they tried to do some efforts, but the response were mainly national. And this is a limit as well. I had another PhD that studied regional integration during the pandemic, and he identified that the regional mechanisms were very weak, despite the efforts of the international organizations, the Latin American international organizations, even regional like the PAHO or sub-regional like SELAC. And there were efforts, there were proposals that were some political mechanisms, but they were not sufficient. In practice, the strategies were more national, and this is a problem because the countries can't solve this kind of complex problem that's global, locally or nationally. One of the lessons is the necessity, the need to strengthen the regional integration mechanisms.
Okay, that's fantastic. Thank you very much.
Thank you.
Great, very
Thank
interesting. No, so thank you.
Thank you.